I'm Dr. Jyothishmathi from Sree Raghavendra Fertility Centre, Mailardevpally. After a couple has decided to undergo an IVF cycle, there are a few important things they need to know before they actually start the cycle. Let us discuss these important points in this video. The process of IVF starts from the second or third day of periods of the lady or the female partner. Now, the lady is expected to come to the hospital to undergo a few blood tests and ultrasound scan to check everything is right to start the cycle. The lady is expected to take injections for about 10 to 12 days at a particular time every single day. Now, why do we need so many injections? By nature, the human body is designed to produce only one egg in one menstrual cycle. But in the IVF process, we want the lady to give more number of eggs so that we can form more number of embryos for transfer. For this, we need to give many injections to the lady. But most of these injections are not very painful and they are administered by small needles to the abdomen of the lady, and they are quite comfortable compared to the older generation injections. After taking injections for 10 to 12 days, the lady will also have to undergo few scans in between every 3 to 4 days to ensure that the follicular growth is as expected. Now, once the follicles or the egg containing bags have reached the desired size, the lady is expected to take a trigger injection. A trigger injection is the one which helps to change the immature follicles to more mature ones, which are useful for the further IVF process. Once the trigger injection has been administered, the lady will next have to undergo the step of oocyte retrieval or ovum pickup. This is again a very time-sensitive process and it has to be done between 35 to 37 hours of the administration of the trigger injection. In the process of oocyte retrieval, we will be taking out eggs from the lady's body. Now, how do we do that? The process of oocyte retrieval is done under anesthesia. So once the lady is given anesthesia, through the internal scan or the transvaginal scan route, there is a long needle which is placed through, which helps us to remove all the fluid from each of the follicle. Now, this follicular fluid is removed by a special apparatus which kind of creates a suction which sucks out all the fluid in each follicle. This fluid is the one which contains the egg. This fluid, once aspirated, is transported carefully in required conditions into the embryology lab, wherein the embryologist will be checking this fluid under the microscope, searching for the possible egg. Now, once we find an egg, the egg is taken and carefully placed into the next dish. So once all the follicles are aspirated, all the number of eggs which have been got are placed into the dish and they are ready to undergo the next step, which is the fertilization. The process of fertilization or the mixing of the egg and sperm happens in two ways in the lab. The first way is the conventional IVF, wherein each oocyte is surrounded by multiple number of sperms and then the best of the sperm which nature selects goes and fertilizes the egg. The other process is the more advanced technique of ICSI, wherein each egg is taken and held by a pipette and the best sperm selected is injected into the egg by the embryologist. Either of these ways are used to fertilize the egg to form the first cell of the baby called the zygote. Now, once the fertilization process happens, the eggs are cultured in the incubator for 3 to 5 days. By the time the embryo reaches the third day after fertilization, we expect the embryo to come to a stage of 8 cells. So this is called an 8-cell embryo. It is at this stage wherein we can still do the embryo transfer or put the embryo back into the lady's body. Or if we have good quality of enough number of 8-cell embryos, we can take them to further culture to the blastocyst stage or the day 5 stage of the embryo. The blastocyst stage is considered to be a more superior stage of embryos for transfer. Now, when we look at the numbers, if we start off a cycle in a lady with 8 follicles in each ovary, that is 16 follicles in total, after giving her injections for 10 to 12 days, we can expect about 10 eggs to grow. Once we do the oocyte retrieval process in this, it is usual to get about 8 eggs out of the 10 follicles which are aspirated. Out of these 8 eggs, it is only about 7 eggs which are mature. So please remember that it is only the mature eggs which can be mixed with the husband's sperm. Once the process of fertilization happens, on the day 3 from 7 mature eggs we usually get about 5 embryos, and we extend the culture to another 2 days, we usually get 3 good quality blastocysts. So all these numbers are for most of the women in general. So when we are starting off with 16 follicles, we are ending up with approximately maybe around 5 to 6 8 cell embryos or about 3 blastocysts. Now, in less than 1% of women, there is a condition called empty follicle syndrome, wherein not even a single follicle will give us an egg. So in spite of aspirating multiple follicles from both the ovaries, due to some genetic condition or due to the reasons unknown, some women do not produce even a single egg. Such women are candidates for donor oocyte. But doing an IVF in such women will help us to know that this is the reason why this lady has not been conceiving all these years. Now, on the other hand of this spectrum, we might have some women who have about 16 follicles giving us 15 eggs with very good quality embryos, about 9 8 cell embryos and 8 good quality blastocysts as well. So, there are both sides of the coin. Now, the process of embryo transfer can happen in 2 ways. The first one is the fresh embryo transfer. Let's say we have aspirated follicles in a particular cycle, we have grown the embryos and do the transfer in the same cycle, either an 8 cell or a blastocyst transfer. It is called a fresh transfer. Due to many reasons, it is not possible to do fresh transfer in all cases. A few examples being getting more than 15 oocytes, or the endometrium or the lining of the uterus not being very good, or the hormonal values not being within range. In any of these situations, we will be freezing all the embryos and we will be going for something called a frozen embryo transfer, wherein the embryos are replaced into the uterus in a cycle other than the cycle where they were originally retrieved. Both the processes have got good success rates. The success rate of IVF worldwide stands around 40% per embryo transfer. Now, this success rate can go up to 60 to 80% per cycle of oocyte retrieval, because while transferring, we are not allowed to transfer more than 3 embryos. So if we get enough embryos for 2 to 3 transfers from a single cycle of IVF, the success rate can go as high as 60 to 80%. There are a few complications which can happen to the ladies by undergoing this process. The most important among them is the ovarian hyperstimulation syndrome, or the OHSS. In this, because of giving many injections and due to the development of multiple number of eggs, the women may have some symptoms like abdominal pain or bloating sensation, vomitings and all these things. But once the oocytes are aspirated and appropriate medications are given, most of these symptoms settle down within a week's time. So, this is in a nutshell about the process of IVF. It is important to note that the process of oocyte retrieval or egg recovery requires anesthesia, and it will need admission of 1 day, that is morning to evening. But the process of embryo transfer is usually without any anesthesia, and the lady can actually see her embryos being transferred into her on the scan machine live during the transfer. Hope this video was helpful for you. Thank you.